So I had this moment in the competency, I kind of pulled out the Mylar strip and I realized there was this massive overhang kind of on the gingival level, and it had never happened before.
Dental school is really stressful between exams, competencies. I think everybody has these moments throughout the week where it just feels like the weight of the world's on your shoulders and you feel super stressed.
And so it wasn't a situation that I was really prepared to deal with. And I had a moment of, oh no, what am I gonna do? And having that deep breath that gave me the seconds and the calm and the focus that I needed to really form a strategy to tackle something that I hadn't experienced before.
We were looking for something that would help them deal with the stress of the situation and be more relaxed so they'd have a better outcome with their examination. I remember coming into Dr. Kugel's office and I said, why don't we get Dr. Paston to come and present to the class?
One of my focuses here at Tufts is teaching our students self-regulation, mind-body practices, not just to help them cope with the demands and the stress of dental school, but to teach them to be grounded and mindful practitioners.
I think back to the first competency where we did the deep breathing beforehand, but I remember feeling very anxious and sitting down, and I did the breathing and I felt calm and really in the zone.
Diaphragmatic breathing is a technique that utilizes the full capacity of the lungs and engages the entire respiratory system. And through that practice, the body relaxes, the mind focuses, and it's a very effective technique for reducing feelings of stress and overwhelm.
When I'm doing a competency, I try and practice breathing and focusing and regaining myself when I'm getting stressed or frustrated, because it is going to happen. And we know that. We are trained for that. And we are trained how to move through it and still give the best care that we possibly can.
And this seems to really relax our students and help them focus through the exam.
It seems that they're doing well on these practicals. They seem to be doing better than they have in the past. It seems to have worked.
What we hope is that this training will carry over into their clinical treatment of patients as well, and even into their professional careers.
At this point, I really can't imagine doing a competency without doing the breathing beforehand.
When the breathing exercise is over, I feel a profound shift from an environment of tension to an environment of professional tranquility.
I think diaphragmatic breathing allows me to do that in any type of situation. I'm able to focus, think clearly, and get the results I wish to have.
It's our responsibility as professionals to be able to focus, to be grounded before we see our patients.
For me, diaphragmatic breathing has been that re-gravitating force for myself. There are techniques out there that you can utilize to mitigate your stress, and I think it's something that has been really successful here, and I think it's something that can be really successful elsewhere.
The wellness program at Tufts is actually the reason that it was my #1 school when I was looking around. It indicates that it's a school that really cares about the stress level and well-being of its students. And I think that's something that's going to be applicable for the rest of our lives as dentists. You know, we're going to see new things all the time. You're going to need to give yourself that second and that calm and that focus to make a plan.
What this is doing is teaching our students to connect with themselves. And when we connect with ourselves, we are better able to connect with other people. And in the profession of dentistry, the deeper our connection with others, the better our patient outcomes, the better our dentistry. My name is Dr. Christina Paston, and I am the Director of Mind-Body Wellness at Tufts University School of Dental Medicine.